looked at the types of diseases and the classification of disease, as well as how to identify disease by looking at specific factors, such as symptoms present. We also looked at the study of epidemiology by looking at where the diseases are transmitted from and VHF and Giardia routes of transmission. In part 2, we're going to carry on looking at epidemiology, as in the predisposing factors which lead to the development of disease. We are going to take a closer look at the infectious diseases based on the virus, Ebola, influenza, and waterborne bacterial disease, cholera.
There are many predisposing factors which are there before a disease and infection can develop. These factors make the body move susceptible to transmitting disease factors such as poor nutrition, fatigue, and the environment, lifestyle, occupation, illness and chemotherapy, and emotional stress could all be factors which could increase sustainability to a disease. Some diseases are prominent due to factors such as gender. This can be shown by the statistics of urinary tract infection being more prominent in women than men. Genetics could also be a factor, as well as climate and weather.
Of disease based on the graph which is going to appear on the screen. Period is showing the interval between the person getting infected and when signs and symptoms of disease start to show. Incubation period varies in different diseases, such as flu always has a period of incubation from 18 to 36 days, whilst the bacterium which causes syphilis has a period of 9 to 90 days. Incubation period varies due to microorganism which has attacked the body. This is the degree of pathogenicity based on the number of microorganisms and how the body's own immune system is resistant to the pathogen. After the incubation period comes the predominant period, which is a short period in which symptoms start to appear in some diseases. After that, the period of illness follows. This is when the disease is most severe, when the patient exhibits obvious signs and symptoms such as fever, pain, malaise, sensitivity to light, photophobia, and sore throat. During the period of illness, the number of white blood cells increase to fight the attacking pathogen. If it attacks the pathogen successfully, the period of illness ends. This when the period of decline starts, when signs and symptoms start to clear, but in the period of the patient is still vulnerable to a secondary infection. The final period is the convalescence period. This is when the patient is fully recovered and gone back to a healthy condition.
Development of disease is also within the study of epidemiology, as it would be used to look at the occurrence of disease and what can be done to prevent, such as looking at types of treatment available to treat the disease. Many more factors are to be considered when looking at the cause of the emergence of disease, whose population movements, deforestation, irrigation, long distance travel. These factors contribute to new emerging diseases and re-emerging diseases of previous diseases.
Diseases and re-emerging diseases can affect so many people based on the environment and society. In the developing world, many types of diseases have developed due to factors such as economic growth, population growth, and urbanization, as well as migration, have caused a change in the natural environment and agriculture system. This is mostly the case in developing countries. Ecological studies have shown that spread of infectious diseases have been extremely contributed to by factors such as climate change, accumulation of toxins in soils due to human activity. This has led to reduction in biodiversity and ecosystem function. As it was mentioned before, this is a big issue to people in developing countries, as they have poor sanitation, and climate change is also another factor.
An example of an infectious disease which shows that these factors are a problem is Ebola. Ebola hemorrhagic fever is caused by RNA virus. which is its first outbreak was recorded in 1976. It has an incubation period of 1 week, which the patient starts to show clear symptoms such as high fever, vomiting, respiratory problems, and hemorrhaging. In most cases, death follows, mostly in developing countries, as there is not enough medical help to treat it. Ebola is a zoonotic disease which is transmitted by direct contact with infected live or dead animals and, as mentioned before, environmental factors such as sanitation and climate conditions aid the spread of Ebola. Studies have also shown that Ebola outbreaks occur in forests during rainy seasons, showing it needs high humidity conditions.
One of the diseases which can affect the society is cholera, caused by the agent vibrio cholera. It's caused the patient to have water loss diarrhea. V. cholera is mainly identified by the production of cholera toxins, which cause excessive diarrhea by the release of intestinal fluids, which leads to dehydration and electrolyte imbalance. The cholera would have been secreted into the intestinal lumen. Cholera is transmitted by the consumption of food and water which has been contaminated by feces from patients or carriages. Natural reservoirs of cholera are shellfish and copepods. For cholera to have a significant attack on the body, it must occur in the small intestine, and there should be sufficient V. cholera agent to adversely multiply within the intestine. In healthy individuals, a large number of V. cholera agent is required for it to colonize the intestinal tract, from the jejunum to the colon. When starting to identify an individual has cholera, the signs and symptoms which are shown are abdominal fullness, discomfort, and loss of stool and possibly vomiting too. As time progresses, the period of illness starts as the stool quickly becomes watery, voluminous, odorless. Mucositis may also be present in the stool. The incubation period for cholera is 24 to 72 hours. The bacteria bind onto the small intestine mucosa. At this point, the bacteria is not invasive, but it is secreting collagen, which is a cholera toxin. Collagen is a protein which is composed from two functional subunits, A, which is an enzymatic subunit, and a receptor binding unit, which is subunit B. Subunit A enters the intestinal epithelial cell and activates the enzyme adenylate cyclase, which causes hyposecretion of water and chloride ions. It also inhibits absorption of sodium ions. This goes on to have a knock-on effect, which is the loss of fluids and electrolytes, causing abdominal cramps, vomiting, and watery diarrhea. The fluid loss results from the adenylate cyclase stimulation of cells depends on the balance between the amount of bacterial growth, toxin production, fluid secretion, and the fluid absorption in the entire gastrointestinal tract. More fluid and electrolytes is greatest in the small intestine, where the secretory capacity is high and the absorbance capacity is low. The diarrhea fluid can amount to 20 litres lost per person daily, approximately the same sodium content as plasma, but 2 to 5 times potassium and bicarbonate concentration, resulting in dehydration. Hypokalemia is also a result from dehydration.
Cholera has had a high impact in disadvantaged communities which has poor medical resources. Cholera is identified as an endemic in many parts of Africa and Asia, and has also been recently identified as an endemic in South and Central America. This is the case because these areas have been identified to be underdeveloped areas which have poor sanitation, hygiene, and limited access to clean water. Cholera is thought to be more prevalent than it was 50 years ago, as 100,000 to 300,000 cases are reported annually. This is shown by the number of reported and recorded cases, Africa having 94% of the global total of reported cases. India reported 81% of cases from Asia. Although these are high percentages, they are though not to indicate the true burden of the disease. This is backed up by the World Health Organization saying up to 90% to 95% cases of cholera are unreported and 95% cases happen in Africa.
Cholera does not continue in developed countries where water treatment and disposal of human waste is done adequately. To be identified adequate in public measures, the environment needs to have a good sewage system and a reliable source of drinking water, which will reduce risk of cholera. To think cholera spreads as it does, treatment is so simple, effective and inexpensive. A simple proportion mixture of salt water and sugar can treat cholera, as it can be used as replacement therapy for sodium ions and chloride ions into the body. This treatment is also best done as oral treatment, as no special equipment is needed and several precautions to be carried out. This treatment reduces mortality by 1%.
Which can have an epidemic spread and lead to development due to environmental factors is influenza. This epidemic can result to a pandemic due to different methods of transmission. Influenza transmission can be controlled if it's only being transmitted from one individual to another, such as droplet transmission and contact to contact. A pandemic or flu can be caused by wild aquatic birds as they migrate from location to location, as they are natural reservoirs for all types of flu.
In 1997, the transmission of flu was not believed to occur from other types of animals until avian flu, which was transmitted from humans from infected chickens. Another transmission to humans was the outbreak of the highly pathogenic H5N1 virus. This is known as bird flu. This was caused by a pandemic reported in 2003 to 2009, being 423 and 258 resulting deaths, showing a 61% of fatality. Other animals which can carry the flu virus are pigs. This was a huge story in 2009, as swine flu had been reported by WHO and CDC experts. The traceable origination of disease was from North America, where pigs had managed to have a gene combination with European pigs and Asian pigs, creating a new gene which had never been seen in humans before.
Influenza can cause complications to people who have already have underlying diseases, such as in adults with cancer, pre-existing chronic medical conditions such as heart failure or asthma. Complications are predominant in the elderly patients with chronic cardiopulmonary disease. Pregnant women and people with immune system problems, this can lead to high risk of fatality. In part 2, we've looked at more into epidemiology and development of disease, as in who it affects and the factors to lead to the spread of infection of disease. We've also looked into detail into 3 main diseases: Ebola, cholera and influenza. In the final part, we are going to be focusing on 2 main diseases which have high fatality rates and problems. These are malaria, HIV and AIDS. In this final part 3 of the documentary, we are going to look at 2 main infectious diseases: HIV, AIDS and malaria. We are going to look at the development of the disease and how it affects society. Firstly, we are going to look into malaria.
Malaria is a parasitic disease caused by Plasmodium falciparum, which is a protozoa of the genus Plasmodium, and is transmitted by Anopheles mosquito, which are female mosquitoes. The parasite is injected into the host by an Anopheles mosquito when it's probing for a blood meal. After it's injected itself into the host, the parasite hides for a week whilst it's replicating. After 10,000 to 100,000 merozoites are released into the bloodstream, which invade the circulation of erythrocyte, red blood cells. The parasite goes on to mature from a small ring to a pigment containing trophocytes, and it then develops into a mature schizoned after its nucleus is divided. The parasite P. falciparum, after 48 hours, enraptures the erythrocyte, creating 6 to 36 merozoites, which are released to invade other passing erythrocytes. This will going to cause an explosive infection within the patient, which will have a multiplication factor of 8 to 10 times per new generation. This causes the patient to present symptoms of suffering from fever. Those with poor immune system, malaria can develop into a severe disease. Studies show that 1 of 2 of those who suffer from severe malaria result in death. 90% of these deaths are by children in Africa.
The treatment of malaria relies on a complex relationship between the vector, which is the female Anopheles mosquito, which transmits the P. falciparum parasite, and the host, which is the human. The transmission of the malaria is dependent on the temperature. It cannot occur in temperatures below 16 degrees or temperatures above 33 degrees, and it cannot develop at altitudes above 200 meters of sea level because it inhibits the development of the sporozoite in the mosquito. Malaria is a non-communicable disease, meaning it's not easily spread. It's only transmitted by being bitten by a female Anopheles mosquito, which are vectors. Malaria can also be transmitted through blood transfusion, organ transplant, shared use of needles. An unborn could also transmit malaria from their mother. This is identified as congenital malaria disease, which are present at birth or for.
Disease which can be treated, but it depends on the several factors such as how severe the malaria is, the species of malaria which is attacked in the host, which part of the world it has been contracted from. Other factors come into consideration such as age, weight and pregnancy. It is important that malaria is treated, as 40% of the world population which live in the world's poorest countries are at risk from being infected with the disease. Malaria was once a widespread disease. It was able to be managed in several countries with mild climates in the 20th century. Although malaria still has a high rate in countries with tropical conditions and subtropical regions, and these areas account for more than 300 million illnesses and nearly enough 1 million deaths a year. Of those deaths, 85% are based on children under the age of 5. Other economical factors which back up why eradicating malaria is important is that malaria consumes 25% of household income in Africa, as well as 40% of African public health government spending goes towards treating malaria. Although treating malaria could become an issue, as the malaria parasite is becoming highly resistant to common drugs which are used to treat it, millions of drugs are ineffective to treating mosquito-transmitted diseases.
Organisations are working towards the same goals of eradicating malaria through the campaign Roll Back Malaria. Roll Back Malaria was launched in partnership in 1998 by the WHO Group, UNICEF, UNDP and the World Bank. The aims of the campaign is to keep malaria a high-profile disease, to ensure people are aware of it, and it keeps being funded so treatment can keep being developed. The RBM group set targets to be met by 2015, which are to reduce number of deaths due to malaria globally and nationally to near zero, to reduce incident rates by 75% and achieve Millennium Goal 6, which is to halt and reverse incidence of malaria and other diseases. RBM scheme also promotes use of mosquito nets, which are treated with incidents, and encourage access to effective treatment which is up to date, such as insulin-based combination therapy.
To treat malaria, antiprotozoan drugs such as quinine were once used widely. But the parasite started to show resistance, and alternative synthetics such as chloroquine are used. Other forms of treatment are antimycin-based combination therapy, which is mixed with antiprotozoan drugs such as lumefantrine. The resistance of antimalarial drugs is becoming a huge issue, such as a high rate of resistance of chloroquine due to 1970s, 80s, due to it being used as a widespread drug which caused resistance to occur and becoming not as effective. There has been reported resistance to antimycin in 4 countries: Cambodia, Myanmar, Thailand and Vietnam. This resistance is potential due to patients not completing the course of drugs, meaning the parasite infection won't have completely cleared up. Other disadvantages of drugs are based on the antiprotozoan drugs, which should not be taken when a woman is pregnant, you suffer from epilepsy or have organ problems such as heart or kidney problems. This is due to the side effects which can occur when consuming these drugs as treatment. Also, the effectiveness of the drug depends on many more factors such as the type of drug being used and the countries being used in. You couldn't use chloroquine in a country which has become resistant to the drug.
Which can affect society is HIV/AIDS. It's an epidemic which continues to build resistance to treatment which is embellished for it. HIV and AIDS is the leading cause of death in Africa, with mortality rates being high in adults aged 20 to 49. This is reducing the life expectancy by 15 years at most by African countries, which are most affected with the disease, as well as outside of Africa in countries which have a lower prevalence of HIV and AIDS has had an impact on life expectancy, causing a high death rate in young adults between the age of 20 to 35 being the most affected.
Many different routes can be taken. One of them is prophylaxis, which are given to prevent or take action to prevent the disease from occurring. This treatment is based on the number of T helper lymphocyte cells present in the blood count. If they're below CD200, this is when the treatment is given. Another method used is highly active antiretroviral therapy, otherwise known as HAART. Before HAART was introduced, lifelong treatment was required, but patients who respond effectively to HAART can stop therapy. Treatment of prophylaxis is also discontinued for patients who achieve a CD4 count above 200. This is an example of when a patient has pneumonia, but if the patient keeps relapsing, they could have induced an allergic reaction to treatment. Therefore, other drugs need to be used.
You can have direct treatment of HIV with combination of antiretroviral treatment, otherwise known as ART. This treatment should begin with patients with symptoms and asymptomatic patients with a CD4 count below 500 cells. Have a rapid drop in CD4 or high viral loads, risk to cardiac disease, pregnant or have HIV-related renal impairment. This treatment is also carried alongside opportunistic pathogens, infection treatment. Treatment can also have issues as the viral envelope of HIV is great variability, causing problems with development of vacancies. HIV is mostly transmitted through sexual intercourse, and gender equality has caused a risk in the epidemic. An example is the spread of HIV is extremely high amongst those who lack protection and human rights and equality. An example of those specially affected are drug users, sex workers and migrants.
HIV needs to be treated due to its effects it had across the globe. Demographically, in 2002-3, 42 million people were reported to have AIDS, 4 times more than in the 1980s. The death rate due to HIV has dramatically risen In 2003, 3 million people's lives were taken, and it is estimated between 1995 and 2025 death by HIV numbers will be 335 million, reducing life expectancy in African countries to 39. HIV can also have a high impact on the household, especially in poor areas, by the cost and others can cause a burden on the family, and this can lead to a large scale of poverty and social structures such as young children looking after their young siblings. Agriculture is also affected in countries with high rates of HIV and AIDS. Death rate as there aren't enough workers, labourers, which go on to lead to land not being farmed on and less yield being produced to sell and supply for the whole country. It is estimated that 10 to 26% of agricultural labour will be lost by 2020. The education system will also be affected. If there isn't sufficient treatment, due to less children going to school, as they will be looking after their own siblings or taking care of their affected relatives. This is shown by statistics showing less than 60% of 10 to 14-year-olds in African sub-Saharan regions don't attend school.
Factors listed above show that Africa is the most affected region by AIDS and HIV. It has high healthcare costs, losing its skilled labourers, and individual households are affected dramatically. This reduces economical growth for the countries which are highly affected. Furthermore, the disease has also affected healthcare systems in high-income countries due to them having to provide high-quality treatment through the health services, through drug development and treatment. The storage of health systems was clearly outlined when ART was launched, and people in the countries were not equipped to provide the aid, such as shortage of nurses, doctors and support staff. This was indicated by countries such as India, Bangladesh and Indonesia having a need of 4 million health workers and 2.4 need to be doctors. AIDS in some way can be seen as a discriminative disease. An example of this is higher income groups living in urban settings have a higher HIV prevalence than those living in rural areas. Amongst those are urban dwellers, those living in shanty towns and in poor slums, also shown a higher prevalence of HIV than those who with better socioeconomics.
Highly dependent on social funding to fund support groups, development of treatment, and if not funded, this will have a high impact economically and on society. Such as this increase of orphans is rising due to the age of which parents die are between 20 to 40, and this is when kids are most needed to be catered to. 50 million kids have lost their parents worldwide due to the epidemic. 12 million of them is in sub-Saharan Africa. Over 25 million people have died due to AIDS since this discovery 25 years ago, making it the most challenging social security factor globally. It was reported by the end of 2007 between 30.6 to 36.1 million people are living with AIDS, and 2.5 million of those are children. This brings our documentary to an end. Hope you've learned something about disease and infection and the different types of diseases which were mentioned. Thank you.